Hello everyone. Everyone's heard of color blindness, but what does it really mean? When someone says they are colorblind, they don't actually mean that they see world in black, although it is quite possible. But colorblind people usually see colors in more repressed state. So today, I, Dr. Shweta Jain, am going to give you some insight on this topic. Let's get started. One person in 12 men and 200 women experience color blindness. It is more common than you think, which is why it's quite sad that even with 330 million people across the globe suffering from color blindness, red, yellow and green are the universal colors for stop and go in traffic signs. And even though it doesn't sound like it, color blindness can be very hard to deal with. There's a lot of things you cannot do if you are colorblind. You cannot be an electrician, engineer, pilot, astronaut and even a chef. Let's move on to what causes color blindness. Causes of color blindness. Although it is widely understood that color blindness is genetic, you can develop color blindness as a result of eye diseases. However, when somebody develops color blindness as a result of an eye disease, the disease is little more variable in expression. For example, one eye might experience colors more intensely than the others. Some of the diseases which can cause color blindness include glaucoma or macular degeneration, or brain and nervous system diseases like Alzheimer's or multiple sclerosis. The cause behind genetic color blindness is the absence of or problem in the function of one or more color sensing photoreceptor cones in the retina. The color sensing cone photoreceptors are of three types in total. First, S cones. S cones pertain to shorter wavelength of light. These are in blue color zones. M cones. M cones pertain to medium range wavelength of light. These are usually in green color range. Third, L cones. L cones for the longer wavelength of light which pertain to red color range. A person who has all these cone functions in their retina is known to have trichromatic function. But with colorblind people, either of these three cones are dysfunctioning. So let's come to types of color blindness. Let's now give deep into type of color blindness. Red-green color blindness, blue-yellow color blindness, and lastly complete color blindness. Red and green color blindness make it harder to distinguish between red and green color. It is of four types. First, deuteranomaly. Deuteranomaly is the most common type of color blindness which makes green appear more red. Second, protanomaly. This kind of color blindness makes red appear like it has greenish hue. It is quite mild. Third, protanopia and deuteranopia. Both makes it difficult to distinguish between red and green. So let's now move on to blue-yellow color blindness, which makes it harder to distinguish between blue and green color as well as yellow and red color. It is of two types. Tritanomaly. Tritanomaly makes it harder for people to tell the difference between blue and green and between yellow and red. Second, tritanopia. This type of color blindness make it impossible for people to distinguish between blue, green, purple and red and even yellow and pink. In a lot of cases, it diminishes the brightness of the color. And finally, we move on to the most dramatic kind of color blindness, which is complete color blindness or monochromacy. Although this kind of color blindness is quite rare, in worst cases, it can even lead to increased light sensitivity and vision problems. Diagnosing color blindness can be hard, so if you start facing problem in color vision, you should and must get some professional help. Your doctor might be able to properly diagnose you and help you out. Yes, there are certain color blindness tests available to find if you have color blindness. The Ishihara test happens to be one of the most common ones out there. First, Ishihara color blindness test. This very test helps you find out if you are colorblind or not. Ishihara test is one of the most famous color blindness tests out there. What it mainly does is that it checks for green-red color blindness. The professional asks the doctor to look at a series of circles known as plates in medical terms. There are multiple versions of Ishihara test present online, but in order to be professionally diagnosed, make sure you take one under professional supervision. These consecutive series of circular plates are made up of numerous dots of different colors, shapes and sizes. They might be forming 1 or 2 digit number also. If you fail to distinguish between the two different colors, you won't be able to identify the shapes either, and hence proving that you are facing the problem of color blindness. Now let's move on to second test. Second, anomaloscope color blindness test. It is based on matching two different light sources to the same color. On one side there is a yellow light which has adjustable brightness, and on the other side you have red and green light which mixed together forms different shades of yellow light. The proportion of this mixture is variable and can be adjusted. It aims at color perception examination in red and green and blue and green range. Moving on, we have third, Cambridge color blindness test. This particular test is very much like the Ishihara color blindness test. The only difference is that here you will be asked to pluck out letters instead. The shape C will be in different color than the background holding that shape. The test is used to examine color discrimination even in more detail as a result of congenital or acquired condition. Another test that we have is Farnsworth-Munsell 100 hue color blindness test. Where you will be given blocks or pegs that are of different shades of the same color with a very little amount of variation, and you will be asked to isolate and arrange them in a definite pattern. Next up in the line, there is a Farnsworth lantern color blindness test. Used in US military to recheck the recruits for color blindness. It works on the principle of hue discrimination. Any misplacement of the hues can indicate some sort of color perception deficiency. There were the various tests done to determine color blindness. Next, we move on to treatment. What can you do to see better if you have color blindness? Color blindness glasses. Since color blindness is a genetic disorder, there is no permanent cure for it, but you can improve it by using color blindness glasses. You can use color blindness glasses. These glasses use a filter to cut out these overlapping wavelengths, allowing for a clear discrimination between colors, especially red and green. The desired result of the color blindness glasses effect lasts only as long as they are being worn. The glasses do not modify a person's photoreceptor, optic nerve or visual cortex in any way to fix color blindness permanently. Some color blindness glasses cost several $1,000s. It is important to set realistic expectation of how much these glasses might change your vision before you buy. Color blindness glasses are not typically covered by insurance because color blindness doesn't affect a person's health, so treatment isn't medically necessary. Secondly, gene therapy. There are few alternative options to treat color blindness. Gene therapy has been developed by researchers who have successfully allowed red-green colorblind monkey to see new colors. This seems like a promising treatment, but it has not been tested on humans yet. Color blindness is the reality that many people live with without being diagnosed. They suffer because ignorance around the disease leads to them being labeled as thick in the head. Therefore, it is important to get tested. If this video was helpful, press the like button and subscribe for more such informative videos in the future. Thank you.